I think we already have like a sense of like the complexity of the topic, and like keep your questions in your mind, create more exciting questions because you have more chances to query their minds on Saturday with a big round table. And right now, I will hand over to our next speaker, which is taking our perspective now a little bit, like beyond just the US and India specifically, and focuses on like what are some of these specific mediumship possession experiences and their relationship with mental health. So I'm talking about Everton, our great friend. He has decided to join the bright side and come to EDOR. So he is now a researcher at EDOR and a fellow of the Pioneer Science Initiative. He was, I guess, a professor of religious studies at PUC, Sao Paulo, and previously also worked as a postdoctoral research fellow at Coventry University in the Brain Belief and Behaviour Lab and University of Oxford and the Scholarship in Christianity in Oxford group. And currently he's the president of the Parapsychological Association in the US. And he has a very broad range of interests in this area, knows this work on religion, spirituality, paranormal beliefs in great depth, and I'm really looking forward to this big panorama of the wider picture globally. Everett.
So, hello everyone. Thank you very much for being here today. I hope you enjoy these 3 days of much discussion, presentations. So today I'm going to talk about the relationship between non-ordinary experiences and mental health, but focusing on a specific type of non-ordinary experience, mediumship or possession, kind of illustrating some of the topics, the issues that were already discussed, raised by Anne, Elliot, Alexander. But I will also explore some of the research that we've been conducting in the context of the IDOR on these topics, okay? So before moving on, I think it's of fundamental importance to define what I understand by mediumship. There are many different definitions of mediumship. They may vary according to the cultural context, the belief system of the individual, the experiencer, the spiritual tradition, and even according to the scientific discipline under consideration. But for the purposes of this presentation, I will define mediumship simply as an experience during which a person believes to be under the mental or physical influence of a spiritual or non-material being, be it the spirit of a deceased person or other spiritual entity or deity, and in some cases even certain forces or conscious energies. So the underlying force, agent, entity, or causal factors underlying the experience will vary according to how these experiences are appraised. Okay, there are actually many experiences that can be appraised, considered as mediumship, although some experiences might be more associated with this definition. Actually, there is significant variation across cultures, across religious groups. I'll talk more about this later in the presentation. One of my intentions with this presentation is to show how mediumship is actually an umbrella category, a catch-all term or superordinate category that encompasses a series of different experiences. Sometimes I see mediumship as a kind of sensitivity to different sensations, emotions, processes, a high sensitivity. There are other terms that are used to define these experiences. All this endless discussion about terminology that all the other speakers also mentioned. So, for example, in some literatures, in some research fields, they prefer the term possession to describe these experiences. So in the anthropological literature, in the psychiatric and psychological literature, the terms mediumship and possession are often used interchangeably to describe virtually the same experiences in terms of their phenomenological characteristics. Of course, I'm not talking about here of a possession in terms of demonical possession. And in Brazil, for example, people tend to prefer the term mediumship instead of possession. And possession is often used to describe more negative, distressing, uncontrollable experiences. In Kardecist spiritism, for example, people may talk about possession as a form of obsession, as a pathological presentation of mediumship. So there might be these cultural variations, but I'm using these two terms as synonyms here, okay? And there is another term that is often used in the US, channeling, that also encompasses very similar reports and experiences, beliefs. So, for example, automatic writing or psychography is an experience or practice that channelers in the US may also report. And sometimes it is very difficult to differentiate a medium in Brazil doing automatic writing and a channeler in the US doing automatic writing. For all the purposes, in terms of the practice, they are very similar. So channeling is another term that may be used in the international literature. The difference here lies more in the belief systems. So some channelers may explain their experiences in terms of a connection with a higher self or connection with angels, other entities that are not so common in the context of spiritism or African-derived, indigenous-derived traditions in Brazil, okay? Well, much of the initial research on mediumship, scientific research, emerged in the late 19th and early 20th centuries when spiritualism had spread throughout Europe. It initially emerged in the U.S., but then spread to a series of other countries, including many countries in Latin America. It was an important spiritual movement at the time. Some historians call it modern spiritualism. This movement based on belief in afterlife and the communication between the living and the deceased, and many doctrines, philosophies emerged out of spiritualism, including spiritism, which is very, very common in Brazil. As Alexander already mentioned it, in late 19th and early 20th centuries, some of the pioneers of modern psychology and psychiatry, such as William James, Theodore Flournoy, Carl Gustav Jung, and many others, were very interested in the experiences of mediums. Psychology and psychiatry were nascent disciplines at the time. They were in their infancy. And one of the first objects of study, subject matters of psychology and psychiatry, was mediumship. And then you had these two different perspectives. On one hand, you had those who were more interested in the psychic abilities of mediums, psychic phenomena that mediums presented. They tended to see mediumship in a more positive light as related to well-being. For example, Jung associated mediumship with the individuation process, with personality development, with access to latent potentials, creativity, and so on. And on the other side, on the other hand, you had authors who had a more negative view and sometimes even a combative perspective toward spiritism. They thought that spiritualist ideas were a menace to the establishment of scientific psychology. So they were trying to show to the public that, well, we do science. This is not science. These are popular beliefs, pseudoscience. So they had this more negative view and tended to associate spiritualist practices and experiences to pathology. It is interesting because one of the first organizations to investigate these experiences was the Society for Psychical Research. At the time, the difference between psychology and psychical research or parapsychology was not clear. So there was some boundary work made by skeptics, by some authors such as Stanley Hall, Joseph Jastrow, and many others to try to separate these fields, but they were united in the very beginning. And many psychical researchers attended psychology congresses at the time, and an important advancement was made in research with the report on the census of hallucinations, which was one of the first prevalence studies carried out, one of the first studies to map the phenomenological characteristics of these experiences in the general population. And that verified that these experiences are not necessarily associated with psychopathology. So people, normal people, so as to say, may report these experiences frequently, and this was an important finding, but seemed to be neglected in a certain way because the psychopathological view of mediumship won, and many authors such as Charcot, Pierre Janet, and others defended this predominantly pathological interpretation of mediumship, associating these practices, these experiences to hysteria. Hysteria was a very common diagnosis used at the time. Also was a catch-all term and a superordinate category encompassing different symptoms that seemed to indicate a neurological disorder or other organic disease, but actually had a psychogenic origin. So hysteria could include dissociative trance, multiple personality disorder, as already mentioned by Anne in her presentation, conversion symptoms, psychogenic non-epileptic seizures, and many other symptoms. And there was a tendency at the time to try to explain mystical spiritual experiences as pathological phenomena. So when these authors identified in their own hysteric patients characteristics that were similar to religious or spiritual experiences, they tended to say, well, this is an example of how these experiences emerge. They emerge in the context of pathology, but they were actually biased in the sense that they were looking at these experiences through a more clinical perspective and in a hospital setting. So this is an interesting picture of a patient from Charcot, Augustine, during reported trance or ecstasy, Nonordinary experience. This interesting book by Henri Ellenberger, The Discovery of the Unconscious, provide an overview of this research, of this history in much more detail, so I recommend this book. During the second half of the 20th century, actually in the first half of the 20th century, this research on mediumship did not progress. And basically, the psychiatrists, psychologists reproduced the same narratives as that of psychiatrists at the late 19th and early 20th centuries. But at the second half of the 20th century, a new perspective emerged based more on a socio-anthropological approach, headed by authors such as Bastide, Herskovits, Erica Bourguignon. So they defended that mediumship should be understood in terms of group and institutional aspects. So they had this more sociological emphasis. And they considered mediumship as a non-pathological phenomenon. So it was seen more as a cultural expression or manifestation, and they focused on other traditions beyond spiritualism, such as African and indigenous-derived traditions in Brazil. And their work was important to denounce inequality and gender and racial discrimination among members of these groups at the time. So it had a more social concern. And although this perspective was very important to bring this cultural sensitivity in the study of these experiences, it took some time for this perspective to influence the views of psychiatrists and psychologists. So it was only at the late 20th and early 21st centuries that psychiatrists started to discuss this in more depth, in more detail. So, for example, discussions about how idioms of distress and symptoms are constructed socially in different cultures, how, for example, certain mental disorders seem to be more specific of certain cultures, so the idea of culture-bound syndromes emerged, the notion of cultural competence, so clinicians, mental health professionals should develop these competences, this cultural sensitivity, understand that sometimes what they in their respective cultures understand as pathological may not be pathological in another cultural context. Some discussions emerged, especially in the context of the DSM-4, the Diagnostic and Statistical Manual of Mental Disorders, in its 4th edition. Some discussion emerged about the inclusion of a possession trance disorder, a category, to define these experiences and try to differentiate pathological from non-pathological possession. And more recently, in the DSM-5, some discussion about how certain cases of dissociative identity disorder may have a folk presentation in terms of possession. So they started to discuss how to differentiate pathological and non-pathological experiences instead of pathologizing possession or mediumship without further discussion. Another important contribution was made with the religious or spiritual problems category that was, interestingly, it was developed and proposed by transpersonal psychologists such as David Lukoff. So they were interested in showing how experiences such as near-death experiences, mystical experiences, can occur without a need for care. So people might face religious or spiritual problems derived from their practices or experiences, but these experiences are not necessarily pathological or a sign of mental disorder. So it would be important to have a category in these diagnostic manuals to show that, well, sometimes people may have problems with their religious beliefs, spirituality, that may be of clinical attention, but do not necessarily fit psychiatric diagnosis. So this category can be used when the focus of clinical attention is a religious or spiritual problem. Examples include distressing experiences that involve loss or questioning of faith, problems associated with conversion to a new faith, or questioning of spiritual values that may not necessarily be related to an organized church or religious institution. Well, despite all these achievements and cultural sensitivity and recognition of the role of culture in defining when these experiences are pathological or not, the fact is that the psychopathological model of mediumship is still important in the context of psychiatry and psychology. We still tend to associate these experiences to psychopathological categories such as dissociation, psychosis, and this is even a way of some authors to publish their papers on mediumship. So to make their papers interesting for mainstream discussions in psychology and psychiatry, they need many times to associate these experiences to topics like dissociation, psychotic-like experiences, and etc., instead of studying these experiences in their own right. So we have a problem here in the sense that we cannot go further than that, beyond than that, to develop other ways of thinking about these experiences. So this is important to change. We need to change that. There are some attempts to at least reduce this pathologization. For example, some authors define mediumship in terms of an adaptive or culture-bound dissociation, while others argue that mediumship can have both healthy and pathological presentations, but still the psychiatric or psychopathological perspective is dominant. But what is exactly dissociation? And here we have another problem, because dissociation is a very generic term, broad term, another catch-all term that encompasses many different experiences. There is much controversy, much discussion in the literature about how exactly to define dissociation, dissociative experiences. So we are actually exchanging something about which we don't know much about with other term about which we also don't know very much. So some attempts to define mediumship, for example, this definition by Etzel Cardenha and Eve Carlson, two renowned authors in this field. Dissociation can be defined as an experienced loss of information or control over mental processes that under normal circumstances are available to conscious awareness, self-attribution, or control in relation to the individual's age and cognitive development. Well, many different experiences could be considered as part of this definition. And actually, these are some of the categories of dissociative processes discussed in the literature, such as depersonalization, derealization phenomena, for example, looking at the mirror and do not recognizing yourself, absorption, imaginative involvement, when you get so involved in a practice, in an activity that you tend to be distracted or do not perceive other things happening around you, dissociative amnesia, in which you have these losses of memory that are considered to be of psychogenic origin, possession experiences that are already mentioned, and somatoform dissociation, physical symptoms or physical-like symptoms that could be considered signs of distress, stress, and other kinds of symptoms. So you can see that many different experiences could be considered dissociative, so it's not a very specific and objective definition. But what the evidence tells us about the relationship between mediumship and dissociative process or experience? So it might be interesting to look at the data to see if we can make sense of all these terminological issues. Overall, the evidence is mixed, with some studies supporting the notion that dissociation correlates with or predict the frequency and or intensity of spiritual experience, such as mediumship possession, while other studies found no or weak support for such a relationship. So we have mixed findings in this regard, and these findings tend to vary according to the religious context that you are investigating, according to how much experience the medium has, how much the medium is dedicated to this mediumship activity. So one of the interesting findings is that mediums are not an homogeneous group. So there are many important differences between mediums, and we know this even based on more religious literature, spiritual literature. There are different kinds of mediumship. So some forms of mediumship are more related to visions, to hearing voices. Other experiences are more related to intuitions, to inspirations, and etc. So and probably each one of these types of mediumship may correlate with mediumship differently. But despite all this controversy, a series of studies found evidence that negative experiences of mediumship possession, that is, experiences involving suffering and social impairment, are trauma-based. So they follow a similar pathway in comparison to other mental health disorders or mental health problems that also have this correlation with trauma and other negative past experiences. But the role of dissociation and trauma in possession is contested by some authors, even regarding negative presentations. For example, there is some controversy on whether and how such experiences should be classified in psychiatric manuals, and whether possession really involves dissociative processes. So sometimes people may find problems with their mediumship experiences. They may involve suffering, but is this suffering enough to classify these experiences as a mental disorder? So, for example, we know in many cases in Brazil of Umbanda mediums and Spiritist mediums that say that these experiences are not always promotive of well-being. They might, in some cases, involve negative effect. They might be negative sometimes, but this is part of the process. This is part of being medium. Part of being medium is also accepting the fact that sometimes you have more challenging experiences, and this does not necessarily mean that these individuals need some help or have a psychiatric diagnosis. So it's very difficult. It's much more difficult to differentiate pathological pathological from the non-pathological than the psychiatric literature tends to conceive. And there is another problem, is that the notion of dissociation favors a secular model of the mind, according to which the individual is being haunted by a dissociated part of himself, as in multiple personality disorder or dissociative identity disorder, which is the more contemporary term for MPD. So the individual is being haunted by a dissociated part of himself, rather than being influenced by a spiritual being or force. So actually, dissociation may not be a causal factor, but just a secular interpretation and naturalistic interpretation for an experience that in other contexts is interpreted in terms of spiritual religious processes, supernormal processes, etc. So what psychiatrists, psychologists do not recognize is that their definitions are also culturally shaped. So it's important to be sensitive to that, not only the culture of the other, but also of the influence of our own culture and how we appraise, interpret, and deal with these experiences. From this viewpoint, the concept of dissociation is a secular equivalent of possession and other spiritual experiences. But is dissociation helpful? Is a helpful concept in understanding mediumship experiences? The phenomenological characteristics and correlates of mediumship deserve further empirical investigation across cultures in order to clarify its association with dissociative and other psychological processes. So this is an interesting graph based on a search on PubMed with the terms mediumship or spirit possession. So we can see that research in this field increased in recent decades, which is interesting. But on the other hand, we still have few publications in this area. So it's still a very niche area, and much more improvements, advancements can be made in this regard. Overall, research has demonstrated that mediums are at least as healthy as the general population. They may report dissociative symptoms, but these usually do not fit the criteria for dissociative disorders. Mediumship can also not be easily equated to dissociative identity disorder, in that mediums differ from DID patients described in the literature. So we are not here in this findings focusing on the experiences themselves, but on the individuals who have these experiences. So we know that mediums differ from DID patients described in the literature in terms of a series of mental health indicators. So we are probably not talking about the same phenomena. So this is one possibility. So there are some connections between mediumship and dissociation, but perhaps mediumship and dissociation are different phenomena, or only are only related in some cases, and in others they are not. Roxburgh and Rowe, and this is not a finding in Brazil. We also we found similar findings in other countries. So, for example, in UK, Elizabeth Roxburgh and Chris Rowe carried out an interesting study in which they did not find significant differences between a group of spiritualist mediums from the Spiritualist National Union, the official body regulating spiritualist churches in the UK. There they use the term spiritualist churches. In Brazil, we use spiritualist centers, but it's a different perspective. And a comparison group of non-mediums in terms of dissociation. And they found that there was no significant difference. Also, the group of mediums reported lower psychological distress and higher psychological well-being. As I already mentioned it, the mediums cannot be considered a homogeneous group, so there might be differences. In this interesting study by Negro and other collaborators, participants' scores in a subset of 80 items from the dissociative experiences scale taxon, which is thought to be more sensitive to pathological forms of dissociation, were associated with more antecedents of psychological distress, poorer control of mediumship behavior, this is an interesting finding, and poorer social support in a sample of Brazilian spiritist mediums. So this is in a way reiterates what Alexander mentioned early in the morning, that sometimes mediumship is related to pathology, not because the experiences themselves, but much more because of the social context. So if the context is favorable to the experience, if the person experiences support regarding the experience, this tends to reduce possible negative consequences of the experiences. So very briefly, this is actually a PowerPoint for another presentation, so that's why it's just study one. But actually, it was a study that I carried out for my one of the studies I have carried out for my PhD dissertation some years ago. So members of mediumistic religions such as Spiritism and Umbanda participated through social media, snowball sampling, and we targeted these mediums through Facebook groups and visits to religious institutions. And we submitted a series of different questionnaires to these participants, asking about childhood trauma, dissociative experiences, and also specific aspects of their practice as mediums. And we compared their findings with the general population. So you can see that there are scores on dissociative experience, on the different subscales of the dissociative experiences scale, are very similar to those of the general population, if you consider here the standard deviation, but they differ from DID patients described in the international literature. Although still high, the scores of the mediums were not associated necessarily with childhood trauma, which is considered an important factor, causal factor or possible antecedent of dissociative disorders. So no significant correlation was found, etc. This is an interesting one. No significant correlation was found between the DS total and subscale scores and religious attendance, individual practice such as prayer or rituals, and perceived importance of mediumistic spiritual practice in one's life. So mediumship was not associated at all with different aspects of their mediumistic practices. In this other study that I carried out more recently with the help of students, we repeated some of the same scales, submitted these questionnaires to another sample of mediums. It was also based on snowball sampling, and we targeted these mediums through visits to specific religious groups. And we also submitted the dissociative experiences scale and a series of other questions about their practices. And once again, in this case, we differentiated the mediums from the attendees. So we wanted to see if there would be differences between those who practice mediumship regularly and those who are members of the religious group but do not consider themselves as mediums. And we could not find any significant difference between mediums and attendees in terms of dissociation. So this seems to suggest that dissociation is not specific of mediumship in this case. And once again, their findings were not so different from the general population, even though their scores were a bit higher in comparison. Mediums whose spiritual, but we did find some association. For example, mediums whose spiritual experiences began during childhood and before attending a religious group scored significantly higher on the depersonalization subscale. But their mean score was nevertheless small. So it is difficult to know whether we are finding a spurious correlation here. So more research would be important to establish these findings. We have published some of these results in a paper in the International Journal of Latin American Religions, in which we explore the social support, help-seeking behaviors, and positive negative effect among individuals reporting mediumship experiences. And we found that anomalous mediumistic experiences were more often associated with positive emotions overall. For example, tranquility, peace. And still, the most reported experience, emotion was fear in relation to the experiences. So 64% of the sample used positive words to describe their first mediumistic experience, the first experience that they had in their lives. Okay. And in these two graphs, we compare the positive and the negative effects attributed to these experiences, and we can see that the positive ones were more prevalent. Of course, there's always the possibility of social desirability, responding, and other issues, but it is one of the few quantitative studies that tried to map this in a mediumistic religion in Brazil. Some other interesting findings: when mediumistic experiences began in childhood and already within a religious context, participants reported having experienced lower negative emotions in relation to their experiences, compared to the occasions when these experiences began in childhood and adolescence. When the experiences initiated before the participants started attending a religious contest, the emotions associated with first mediumistic experiences were more negative. In comparison, when mediumistic experiences emerged already within a religious context. So these findings suggest that, once again, the social support of the group and the moment in the onset of the experience is very important. So when these experiences start early in life and there is no support from family, peers, the social context, this tends to bring more negative consequences to these individuals. And some neurophysiological and cognitive correlates findings tend to support these other studies, more focused on individual differences. So electroencephalographic evaluations of mediums have shown that mediumistic experiences are not indicative of epilepsy, whereas the occurrence pattern during mediumship differs from pathological dissociation and hypnosis. The findings are more consistent with the occurrence of absorptive states, during which mediums, more particularly expert advanced mediums, retain a significant amount of cognitive control over the experiences. This was an interesting study I have carried out many years ago with Professor Stanley Krippner. We submitted a series of psychological questionnaires and interviews with a medium who had this practice of mediumistic painting in Brazil. And we found that he had very high scores on dissociation and absorption, and we investigated his case in depth, so it's an interesting article to discuss some of these findings. Delorme and other collaborators collected brain electrophysiological data from 6 mediums. The mediums were asked to collaborate in a series of different tasks, such as thinking about a non-deceased person, listening to a biography, thinking about an imaginary person, and interacting mentally with a deceased person. In summary, the results suggested that subjective experience of communication with a deceased person is, as a mental process, distinct from ordinary thoughts and imaginative processes. This has important implications to the early theories on mediumship that tended to associate mediumship with fantasy proneness, hysteric characteristics, etc. In an investigation conducted by Julio Pérez and other collaborators, including Professor Alexander, with beginners and advanced spiritist mediums, all of them dedicated to the practice of automatic writing, the most experienced mediums evidenced a low activation of brain areas responsible for attention and planning while doing automatic writing, a result that not only justified their claims of dissociative state, but also seemed contradictory to the best textual productivity of these individuals during the task under dissociation compared to the same task when they were out of a dissociative state. So here suggesting a difference between beginners and advanced mediums. So once again, mediums are not an homogeneous group, and you have to consider these differences. I have published also many articles illustrating how mediumship differ from dissociative identity disorder cases in the more international literature, showing how, for example, in Brazil, dissociative disorders are poorly investigated. There are very few cases of dissociative identity disorder in Brazil, which is a striking finding because this disorder is in a diagnostic manual that is used by professionals in different parts of the world. But this category is simply not relevant to our cultural context based on, at least on the studies available. So there's not seem to be much confirmation of the cross-cultural validity of multiple personality or dissociative identity disorder in Brazil. And we explored this in more detail in this article, Cultural and Group Differences in Mediumship and Dissociation, exploring the varieties of mediumistic experiences. So mediumship is considered to have many subtypes and does not occur as part of uniform state, but varies along many levels of awareness of the body, the self, and the external environment. Mediumistic experiences and beliefs and the accompanying levels of dissociation do not seem to support a single and monolithic classification, a universal basis or single psychophysiological state. It may or may not involve an alteration in consciousness or dissociative process, and may or may not depend on the same dissociation processes across cultures or even across individuals in the same culture, as we identified important differences between mediumistic groups in Brazil, and these findings are discussed in more detail in this paper. So in Brazil, we did an interesting comparison between mediums in Brazil and mediums in UK. In Brazil, a more collectivist culture in comparison to the UK, the rituals of Umbanda and Candomblé, African indigenous-derived traditions, engaged the mediums and the audience in a much more stimulating way, both physically and emotionally, while the mediumistic practice of the UK, amid meetings with tea, biscuits, and cakes, tend to be more reserved, more rational. Nothing against biscuits and cakes. And focused on individual experiences and manifestations. However, it was also possible to find some similarities between these experiences in the different contexts. So it's important to have this wider perspective considering biology, social aspects, psychological aspects in the study of mediumship. Well, many other articles came to the same conclusion, and this article from Professor Tanya Lerman is interesting because it defends a new perspective to these experiences, not a focus on the psychopathological aspects. So the work carried out by Taves, by Lerman, and many other authors opened up new possibilities of investigating these experiences from a more cognitive perspective, not focusing on these diagnostic classifications, but trying to understand individual differences like absorption and other variables that could be important to understand mediumistic experiences across cultures. And in this sense, that started our collaboration with Professor Taves and Elliot as part of the John Templeton Foundation project. We have published this interesting paper reviewing all the literature on ordinary experiences, well-being, and mental health. So it was a systematic review of the evidence. And we found some interesting, we had some interesting findings. For example, that in many of these studies, the authors use a sum score to evaluate these experiences. And only in certain cases they use scores of subscales. And so there is this tendency to combine different experiences as part of a general score, a total score, and we don't know exactly what they are measuring with these total scores. Is the intensity of the experiences to a specific individual? Is the frequency of the experience? Sometimes this is not clear. And there is another problem that in some of these measures, there is some overlap between the experiences and well-being measures and psychopathological constructs. So sometimes it's not clear whether they are measuring the experiences alone or whether they are measuring the relationship between the experiences and well-being or certain psychopathological constructs. This was also a problem for many years in the field of spirituality and health, and Harold Koenig and other authors denounced this problem, so they started developing measures that evaluate evaluate religiosity, spirituality in a more neutral way, but we still find some of this problem in research on non-ordinary anomalous experiences. Other limitations included the fact that researcher-defined constructs predominated over subject-defined constructs, like the case of dissociation. In many of these studies, they did not evaluate the frequency, duration, controllability, and context of these experiences. We also need to know more about developmental processes, and so we need more longitudinal research, as the findings of the social support study illustrates. And there is a lack of cross-cultural diversity. Most of this research is carried out in English-speaking countries, so we need more evidence for other contexts. So we started this collaboration with Professor Taves and Elliott based on their work with the inventory of non-ordinary experiences, which separates the appraisals from the experiences. So regardless of whether the experience is appraised as related to mental health or as a disorder, as a spiritual religious phenomena, we can evaluate the experiences and their phenomenological characteristics separated from the beliefs or appraisals or attributions made to these experiences. So this is an important step. And another important contribution is that we can evaluate the experiences separately instead of using a total score that we don't understand exactly what is measuring. So we started this collaboration. These are some of the colleagues involved in the project. And one of the sub-projects of this larger research program included creating and validating in Brazil a series of items of mediumship or possession. So we wanted to create and develop and use these items in research in Brazil based on the feature-based approach, subject-dependent approach developed by Professor Taves and Elliott and other collaborators. So our aim was to propose new ways of defining and measuring mediumship possession in Brazil. So we relied on a multi-step mixed methods approach for item development and validation. So we aim to develop and validate these items in Brazil and also explore the prevalence of such experiences in a sample of the general population. This study kind of connects with other study that we are conducting now on the phenomenology and neuropsychiatry of mediumship experiences. So we are interviewing mediums, doing ethnographic field work to understand their experiences further, submitting some questionnaires, and doing a longitudinal assessment of these experiences. Brazil is the largest country in Latin America and have an enormous cultural and religious diversity, including numerous ritualistic practices in which dissociative phenomena or mediumistic phenomena are said to be present. Brazilian mediumistic religions were developed along elaborate historical and cultural trajectories such as Spiritism, Umbanda, and Candomblé. Spiritism is a spiritualist doctrine based on the writings of the French pedagogue Allan Kardec, of which Brazil has the largest community in the world. This is a map illustrating the distribution of spiritists in Brazil. And many African-derived, indigenous-derived traditions emerged in Brazil, in part dialoguing with Spiritism, but also bringing these contributions from Africa and indigenous traditions. So in our multi-step process, we initiated the study with a systematic review of the literature to identify key themes, terms, and measures that are used in research on mediumship and dissociation in Brazil. So this systematic review assisted us in the development of a preliminary pool of items that would be validated later with a sample of the general population. But we observed that it would be interesting to have the collaboration, the contribution of the mediums themselves. So if the mediums could, in a certain way, tell us what items were more characteristic of the experiences they have, then we would obtain another level of validity, subject-dependent validity. So we focused on these amic definitions in this survey with mediums, filtering off the preliminary list of items based on their own selections of the items that they considered more representative of what they experience as mediumship. In a third moment, we submitted these items to validation in a sample of the general population in Brazil using the response process evaluation method as already described by Elliot. And finally, we explored the prevalence of these experiences in a sample of the general population in Brazil. So starting with the literature review, we did this search in ProQuest, and we found 52 relevant documents, articles, books that we conducted an in-depth discussion about this material. And based on this literature review, we created 160 items for potential validation. These were the affiliations identified in the literature in the studies that we reviewed. So Spiritism, Candomblé, Umbanda, Santo Daime, which is based on the use of ayahuasca, and many other traditions were covered by these studies in the literature. We did a qualitative thematic analysis of the experiences reported in ethnographic studies to identify the types of experiences that were most reported by the mediums. So identified experiences such as alterations in consciousness, semi-conscious states, dream states, and other kinds of alterations, behavioral alterations and anomalous self and identity experiences such as changes in voice tone and facial expression and other kinds of similar experiences, intense emotions in a certain way, replicating, so as to say, the findings of the NOE, perceptual or cognitive alterations such as spontaneous mental imagery, hearing voices, olfactive and tactile experiences, somatic manifestations, shakiness or trembling, waves of energy or electricity throughout the body, etc., and other non-ordinary experiences such as premonitions, out-of-body experiences, and thought transmission or telepathy. All of these experiences were presented in the literature by the mediums themselves as examples of mediumship experiences, okay? And we also identified a series of measures of dissociation used in Brazilian studies that we analyzed to see if there were items that we could use in our own study. And we also used some of the items that were already validated in US and India in the context of the NOE, and even some non-validated items we wanted to test to see if we could validate them in Brazil. Regarding the survey with mediums, a total of 22 mediums answered the online survey. Of these, 45% were members of African-derived religions, 32% were spiritists, and 14% defined themselves as spiritual rather than religious. One medium reported various affiliations, and another one described herself as Christian. Regarding gender, well, these are the characteristics of the sample, so we can skip this slide. An important thing to mention is that all these mediums had a high frequency of practice, and some of them were spiritual leaders. So we were careful in choosing these participants. Some of them were also participating in the other study on the phenomenology and neuropsychiatry of mediumship as already presented. So here we have the items that were chosen by the mediums. So we submitted a series of more than 50 items, 60 items if I remember correctly, to the mediums, and they chose the items that they considered more representative of mediumship, so including experiences such as presences, auras, and a series of other experiences. So you can see how varied are the types of symptoms or experiences that they consider mediumistic. Smells, visions, tactile experiences, automaticity, such as in automatic writing, distinct identity, and many other types of experiences. And in the third moment, we submitted these items to the response process evaluation, validation in the general population. This is the final version of the adapted Brazilian validity probes, the questions that we made to participants in relation to each item to see if they understood the questions as intended. So we developed the intended interpretations for each item and compared these intended interpretations with the responses provided by the mediums. Elliot already mentioned that, so I will skip this slide. Here are some of the demographic characteristics of the sample in the validation and in the prevalence study. And here we have the items that were finally validated in Brazil and information about the prevalence of these experiences. So after the mediums selecting those items that they considered more relevant to define mediumship, these were the items that in the general population people were able to understand these item questions, and we asked them about whether they had or not these experiences. So you can see that some experiences were more frequent, such as sounds. It could include hearing voices, but other strange or unusual sounds. Smells. This was a very frequent experience. Sensed presences was also a very common experience, and we differentiated between presence of deceased people and other types of non-ordinary presences or forces. Okay. Psychic vampirism was also another interesting item. So this perception that when you are near a certain person, you feel as if you are losing energy. This is a very interesting item. So a kind of sensitivity, special sensitivity or something like that. This was also frequently reported by the mediums in our other study. Tactile experiences, this feeling of being guided in some way by an ordinary force, etc. So these are all experiences that were considered representative of mediumship. The items another self embody and presence dead had not been previously validated in the USA and India. A total of 5 items obtained validation in the 3 countries. These findings may indicate the importance of cultural practices and appraisals in the recognition and comprehension of specific types of experiences. So we use here, I'll be very brief here actually, but we can use predictive coding as a useful metaphor, as a theory to try to make sense of some of these findings. So basically predictive coding affirms that our brains and cognitive architecture continually generate models of the world, the self, and the body that influence and are influenced by culturally shared knowledge, specific non-ordinary experiences, religious practices, rituals, and notions of mental health pathology. Cultural and personal beliefs about spirits can create strong top-down predictions that shape the individual's perception. These cultural inputs form a significant part of the brain's predictive models. For example, in societies where spirit possession is a well-established concept, individuals are more likely to interpret certain physiological or psychological states as being caused by spirits. So this is an interesting finding because these experiences may not be necessarily associated with mediumship, so this will depend to a great extent on the cultural and personal beliefs that shape our perceptions and guide predictions we make about the world, the self, about our own experiences in the world. Mediumship and possession are often viewed as extraordinary or pathological. However, from a predictive coding perspective, they can be seen as variations of the same cognitive processes that underlie everyday perception and cognition. This can lead to a more nuanced understanding of mental health and illness. By attempting to reduce, at least reduce, the inevitable conflation of experiences with culturally infused appraisals, the NOE, the inventory of non-ordinary experiences, allows for a clear understanding of the cultural factors that shape experiences that are otherwise phenomenologically similar across cultures. So looking forward, it's important to have greater specificity and sensitivity for identifying mental health problems across cultures. So the analysis of the appraisals is the next major step in our study. We had several questions about how people interpret these experiences and whether they associate these experiences to well-being, to positive affect, and that kind of thing. So we are now analyzing this data, and this will be the next major step to try to understand the mental health implications of mediumship or possession experiences. It's also important to identify novel paths for clinical treatment, for example, engagement, overcoming resistance and hesitancy, improve recovery rates, identify biomarkers. One of the interesting findings, I did not mention it here, it was a finding that we had with the whole inventory of non-ordinary experiences, not just the mediumship items. We found that when people responded the inventory after being presented a questionnaire on pathological symptoms, on mental health screening survey, they tended to report these experiences less often. So this tends to show that when people perceive that their experiences are being associated with pathology, they will not be so clear about their own experiences. So this has important clinical implications. New insights into fundamental questions about consciousness and human cognition at individual versus population level also needs to be considered. I think that Professor Alexander covered very well these more ontological aspects in his presentation, but these aspects also have also important clinical implications, because if some of these experiences are genuine in some way, if the mediums are connecting with something higher, so as to say, or if they are assessing latent potentials or psychic abilities, etc., then this should be considered in some way in their own treatment and the way clinicians, mental health professionals deal with these experiences. So it's not possible to completely rule out an ontological perspective. Sometimes when we say that, well, we can deal with these topics in a more secular way or rely on methodological agnosticism, etc., we neglect the fact that most of the time we are neglecting the possibility that some of these experiences are genuine or real. So we say that we are adopting a neutral perspective when in fact we are biased toward the non-existence of these phenomena, and this may have personal clinical consequences. And of course, these studies offer new insights into the co-construction of the mind and culture, and offers interesting interdisciplinary possibilities for interdisciplinary collaboration between social scientists, neuroscientists, psychiatrists, people from different fields, religious studies, and so on. Thank you very much for your attention.
Excellent. Thank you so much for a tour de force across lots of different studies. We have about 10 minutes before we have a much-deserved coffee break. So any questions, thoughts, comments?
Hi, thank you. It was amazing to hear more about the ID, and I have a question about the ID. Around the world, especially in the US, I believe that it's a very common condition. And I want to ask, do you believe there's a misdiagnosis in Brazil, or maybe is there a cultural gap that we don't hear a lot about cases of DID?
Yeah, this is one possibility actually. This is one of the hypotheses we raised in our study, that maybe clinicians are not trained to identify these cases in Brazil. Uh, there is some plausibility for this hypothesis based on the fact that some cases were reported. A small frequency, a small number of cases, but nevertheless, there were some cases that were identified. But still, in many of these cases, there were many comorbidities. And so the diagnosis was not very clear. And I think that it would be important to have more collaboration between researchers in Brazil and researchers in the US and other countries to try to understand whether this diagnosis is genuine or not. There are some interesting neurophysiological findings in research in the US, in the UK, in other countries, showing that sometimes when people are experiencing these other identity states or ego states, they behave in a different way that cannot be easily explained in terms of simulation or that kind of thing. So there seems to be something occurring in these cases. So I'm not, it's important to mention that I'm not discouraging research on DID or similar processes. We need more research, but at least based on the available evidence, there is no much evidence to sustain its cross-cultural validity in Brazil. One of the possibilities that we raised in this paper was that perhaps these people are seeking help in spiritualist centers, are seeking help in Umbanda, giras, and etc., instead of seeking help from psychologists, psychiatrists. So we have this condition of the public health system in Brazil that is not so good. It has many challenges, and perhaps people are not seeking appropriate help for these disorders. But it's also difficult to say to use the word appropriate in this case, because I tend to think that in many of these spiritualist religious contexts, they are receiving an important help. And an interesting study that we could carry out, I have mentioned this to Ron and other colleagues, would be to evaluate in a longitudinal study these mediums when they come to these contexts, and after some time, whether they recovered, whether they felt better about their experiences. We do not have sufficient longitudinal data to understand these phenomena better. So you can see that there is still much research to be done in this area. Thank you for your question.
Oi, Everton.
Onde?
I'll speak in English. I think a part of this problem might have to do with, of course, appraisals, the way appraisals shape pathology itself, psychopathology itself, and the way, for example, when you have a mediumistic experience when you're very young, and you still don't have maybe the cognitive tools or the social tools, you're not inserted in the religious context just yet, and that way you suffer more because you have less tools to signify the experience. That's how I understand appraisals shape experience in general and psychopathology. But not only the meaning, but the purpose that is given to the experience, I think, is very important on how the outcome will be, whether it will be a pathological or a very suffered outcome or a positive and healthy outcome. Meaning that when you can create a purpose for the experience you're living, which certainly happens in spiritual centers and when you seek spiritual help, it will be less likely that your experience will be seen as pathological, will be felt as pathological or seen by other people as pathological, because you're creating something with it, you're building your life positively around it, you're finding other people who feel the same and build the same meaning. And I think that for that reason, there are some kinds of experience that might have better outcomes when you search for a place where other people are living the same kinds of weird stuff, you know.
That is why I think sometimes that these contests might be more therapeutic to these individuals than an individual psychotherapy sometimes. And this brings to us some challenges regarding how we conduct psychotherapy with persons experiencing non-ordinary experiences. We currently do not have protocols for that, on how to deal with these experiences in the clinical context. So there is much research on the relationship between these experiences and well-being indicators, mental health diagnosis, etc. But how should a clinician deal with these experiences when people bring them to the clinical setting? We don't have any protocols or criteria to use in professional practice. And sometimes the religious context is the better place for these people to go. But we still need more research to understand the impact of these practices and the mental health of these individuals. It's important to remember, just a brief comment, Jung used to say that religions are psychotherapeutic systems. So this is something important to have in mind.
Yeah, I just want to build on this discussion by, I think we should make a difference between spiritualizing experiences and normalizing experiences. I mean, they overlap. I mean, the spiritualizing of them normalizes them, but it adds a whole religious or spiritual meaning system to them. I think an interesting analog to what you're trying to get at might be looking at the hearing voices movement.
Okay. Yeah.
Do you know? Well, just for everybody, that's a movement that began in Europe. It's at least spread to the U.S. I don't know if it's come here, but it's mostly made up of people who've been diagnosed with schizophrenia or basically hearing voices, but diagnosed in a clinical context, and they form self-help groups that then normalize their experience, and it's often proved transformative for them in terms of being able to function way better.
They did not spiritualize, but normalized it.
Right, and that's what I'm trying to say, that that's a normalizing option that would be potentially separate from going to, say, a
more secular
spiritist
alternative.
Yeah. So there's a range of options you could use as controls, so to speak.
Yeah. Thank you for the comment. I also tend to think sometimes that, well, I had the opportunity to visit some spiritualist churches in UK when I did my postdoc in Oxford and Coventry, and it was very interesting because these experiences tend to be considered there in UK much more in as bizarre or strange. So people who have these experiences are considered more eccentric. And in Brazil, it's very different because these individuals are actually highly valued in our society. So I tend to think that this also makes a huge difference. So perhaps some of the pathological implications of these experiences have more to do with the way culture accepts or not these experiences than necessarily with the experiences themselves. Yeah. But of course there are some secular alternatives too.
Excuse me. Okay, so first, thank you for the speech. It was so great. My question is, like,
where?
Here. So, like, in my mind, people usually search for the religious center because they have some kind of problem, like money or health. So, do you think that by the fact that Brazil is a country that is still in development, do you think this is a problem on the measures, like Anne was saying about comparing India with United States? But in my mind, it's, I don't know if we can compare Brazil to United States because of like misfortune of people and our culture to go
Do you mean demographic characteristics?
Yes.
Yeah. And this is interesting if you consider that most studies with mediums in Brazil work with mediums that are actually from middle class or the upper class. So we don't know much about mediums who are in another social strata. So this is a factor that should be considered in future research, these demographic, economic aspects.
Yeah, because I'm sorry, again, I was thinking about like João de Deus, that is like a big figure in Brazil.
John of God.
Yes. I know he did some bad things, a lot of bad things, but like I was thinking about how many people went there, and people there wasn't even spiritualists, and they were looking for help. So thank you.
Yeah, great, thank you.
Okay, so going back to dissociation and the concept of normalization of the experiences, if we bring the concept of normalizing anomalous or spiritual experiences, what if we think about normalizing dissociative experiences? Because I've had the opportunity to talk to some people that expressed dissociative identity. I wouldn't call disorder, but they would say they had different alters.
Okay.
And they said, I don't want to go to a psychotherapy where the psychologist will try to remove my alters because they are like my family. So
interesting.
that's a discussion. It needs to be done that I didn't find. I didn't see literature about it. So it's an underdeveloped field.
Yes, very interesting. Actually, this reminds me of some literature on DID that talks about inner self-helpers. There are like mentors or spiritual guides if you look from a more mediumistic perspective. So these are authors that tend to help the individual instead of being more negative expressions of personality. Yeah, so this is very interesting. I take the opportunity to present my friend Mateus, who is also conducting research on mediumship experiences during childhood. A very interesting topic. Yeah.
Thank you. And I'm here just because of him today, I think.
Since Brazil has a lot of spiritualistic groups or religions, to conduct a study like this in Brazil wouldn't bias the population that are included. Wouldn't it be good to compare Brazil or India, for example, which are countries with a lot of spiritual strength, as I would say, with some countries with no spiritual luggage?
More secular countries. Yeah. So, but what do you mean in terms of mediumship or no?
I'm sorry, in terms of non-ordinary experiences.
Okay. Yeah. That would be interesting. I know of some studies on the non-ordinary experiences or anomalous experiences of atheists. So this is a very interesting topic. It might not be the same thing as you were mentioning, but there are some studies showing that people who consider themselves as atheists or agnostics may also report these experiences, usually less frequently than people who have a religious or spiritual perspective, but nevertheless they still report these experiences like lucid dreaming, sleep paralysis, out-of-body experiences, and the way they appraise these experiences differ from religious individuals, but they still have some of these experiences.
All right, thank you so much. I think right now it's a well-deserved moment for coffee to rejuvenate and get some more energy back. Thank you once again, and I'll see you all back in 20 minutes.